Back in January, the hype was deafening. Some swore Ozempic and Mounjaro were miracle drugs. Others called them dangerous fads. Now, in September 2025, the story has diverged a little bit. In the US, these drugs are being pushed into new roles like heart protection, sleep apnea, and may soon be an oral pill. In Australia, the PBS keeps things tight, covering diabetes but drawing the line at obesity. So let's cut through the noise. What does the science really show? What new side effects should we take seriously? And what myths are still fooling people? And what's coming next as we head into 2026? In May, the big trial results came out. Mounjaro or tirzepatide clearly outperformed Ozempic in weight loss. It wasn't close. People on Mounjaro lost significantly more. But the bigger story, Wegovy, the high-dose semaglutide, reduced heart attacks and strokes by 20% in people with obesity and heart disease. That's no longer about looks, that's about survival. And over the horizon, the FDA is reviewing an oral form of Wegovy. Imagine not an injection, but a daily pill that could open the door for millions more, and it could arrive as early as 2026. Wegovy is the same drug and molecule as Ozempic, just a different name. So the hype is still there, but the story has shifted. These aren't just weight loss tools anymore. They are cardiometabolic medicines for the heart as much as the waistline. Of course, side effects remain. Nausea, constipation, diarrhea, familiar by now. But in 2025, new concerns surfaced. Dentists are reporting more gum disease, dry mouth, even tooth decay. What some call Ozempic teeth. Patients complain about sulfur burps. Rare but serious events like pancreatitis, gallbladder problems, sudden vision loss are under investigation. The European regulators are even reviewing possible links to depression and suicidal thoughts. But most people will never face these severe problems. But they remind us these aren't beauty hacks. They are powerful medicines and they need careful use. Let's clear a few up. Myth 1. There are still miracle cures. No, they're not. Lifestyle still matters. Myth 2. Stop the drug and keep the weight off. No, most people regain, though Mounjaro users often regain less. Myth 3. Everyone looks older. Not true. Some look more sculpted, even younger. Take a look at my previous videos on Ozempic and Mounjaro face. There's two faces to that. Myth 4. They are unsafe. Regulated versions are safe. The real danger comes from fake or black market pens. And here's where perspective matters. Australians sometimes feel frustrated that the PBS doesn't cover these drugs for obesity. But let's be honest, Australians don't always realize how good they have it. Diabetes patients here pay a fair price, fixed price, no matter their income. That's equity. In the US, the reality is harsher. The richest country in the world, yet most people don't have insurance that covers these drugs. Even if they do, they're tangled in red tape. and many Americans don't even realize that other countries have overtaken them in fairness and equity. Too many live in a bubble, believing their system is the gold standard when it isn't. So here we are in September 2025. The science is sharper, the side effects clearer, the myths still swirling, and the inequalities louder. And 2026, watch for the FDA's decision on oral Wegovy. Watch for more safety data on eyes and mental health. Watch for the political fights in both Australia and the US over whether these drugs remain a privilege for some or become accessible for many. This isn't just hype anymore, it is a shift in modern medicine. And the next chapter in 2026 will decide how far this shift reaches. If you want to keep cutting through the noise with me, follow this channel for clear, simple but not simplistic, balanced, and down to earth health information. No clutter, no hype, just thoughtful conversations on the health issues that matter most. Thank you for listening.